I think we all know that atrial fibrillation is a huge public health problem. As we learn more about it, we know that a lot of people, atrial fibrillation is asymptomatic, and it can just have few bursts and people don't have atrial fibrillation any long. And our ability to detect it through a 10-second ECG, which is routine clinical practice, is pretty limited. So that is why it is important for us to quantify what the real burden of atrial fibrillation is. The primary findings of this study are few. Number one, we always knew that there is about 2 to 3 million people with atrial fibrillation in this country. But what we find in this study is amongst people we find atrial fibrillation, there are about 50% people who have paroxysmal of atrial fibrillation. So that number of 2.2 million, which was recently published, can bump up to 4.4 million if one has to look at these studies. The other finding is amongst those with paroxysmal AFib, which is 3% of this general population, 5 out of 7 did not know that they had atrial fibrillation and they were not on anticoagulation, which is one of the ways we can modify and reduce their risk by 60% of having a stroke. I think we see a lot of arrhythmias like premature ventricular beat, which are beats which are coming from the lower chamber or upper chamber premature atrial complexes. But maybe 95% of the people living in the communities have them, but we do not have a strong clinical implication of these findings, except for there are some findings which have huge clinical implication. We have never studied populations with long-term monitoring before that other than 24-hour Holter because of our inability to capture this data over long duration of time. But with the advent of technology using the SoziPatch, we have been able to capture longer recording in people who are in the community, because our focus typically has been patient population and not people who are living in community. So SoziPatch is a FDA approved small patch like this patch, which just sits on the chest, glued to the skin. It can sit there for up to 2 weeks and continuously record your EKG, and it is then sent to the company, which provides a very detailed report of every arrhythmias found in these participants or patients. So AFib is associated with about 4 to 5 folds higher risk of stroke. We do not know clearly how much of paroxysmal AFib, which is short bursts of AFib, is associated with stroke. The current clinical understanding is yes, it has similar risk as somebody in persistent AFib, and not treating it leaves them at high risk of stroke as compared to treating them and bringing their risk 60 to 70% down by use of some of the medications available currently. The take-home message is this, that if there is a patient in whom you suspect these arrhythmias like atrial fibrillation and you don't find it on the routine EKGs and your suspicion is high based on a lot of risk factor present or the clinical presentation, longer-term monitoring is a way to go. And right now we have technology, low-cost, non-invasive available to really do that.